Chapter 3. The Plan That Was for a Different Life. Linda Okafor did not panic when her husband was diagnosed. That is the thing she returns to now when she tries to understand what happened, not the diagnosis itself, but her own response to it. She had prepared herself for this kind of news in the abstract, the way careful people prepare for abstract things: an emergency fund, adequate insurance, a financial plan reviewed annually. She was not the kind of person who fell apart. She had watched her mother fall apart and had spent 30 years making sure she would not be that woman. She was calm. She made the appointment with the specialist. She researched the condition. She drove home from the hospital and sat at the kitchen table and opened her laptop and looked, for the first time with genuine urgency, at the numbers. The numbers were fine. That is what she could not explain to people afterward, that in the beginning the numbers were fine. Paul's diagnosis came in the autumn of their third year of retirement. They had left work at 66, both of them within 4 months of each other. It had felt coordinated, almost ceremonial. They had a financial plan that their advisor described as conservative and well-structured. They had $1.1 million in IRAs, a brokerage account, a paid-off house, Social Security that together covered most of their fixed expenses. They had traveled. They had a routine. The first 2 years had looked, from the outside, like the retirement the spreadsheets had promised. What the spreadsheets had promised was based on assumptions that were individually reasonable: a 4% withdrawal rate, healthcare costs inflating at 6% annually, a long-term care event affecting one of them with a probability the advisor had described as significant and had suggested they consider insuring against. They had declined the insurance. The premiums at 62 were $4,200 a year. It felt, at the time, like the premium was the expense and the risk was hypothetical. They were healthy. They were active. They ran the numbers several ways and concluded that the premium represented money they would probably pay and never use. The actuarial tables agreed with them, in the sense that the actuarial tables agree with everyone right up until they don't. Memory care in their county runs between $9,000 and $11,000 a month. Linda does not say this number out loud anymore because she has noticed that it causes a particular expression in people: a brief recalibration, a sudden quiet, the face of someone running arithmetic they don't want to finish. She has had that conversation too many times. The number is simply a fact now, the way a mortgage payment is a fact, except that a mortgage has an end date, and this does not. In the first months after Paul moved to the facility, she was still managing 2 financial lives: his care, her household, the way she had managed everything in their marriage, methodically with spreadsheets. She tracked every expense. She modeled the trajectory. She ran the scenarios with the updated assumptions. The scenarios agreed on something she already knew. The plan was for a different life than the one that had arrived. Not a failed plan. A plan built on reasonable assumptions that turned out not to describe what happened. This is a distinction that matters to her, though she is not always sure she can make other people understand why. She had not been careless. Paul had not been careless. Their advisor had not been careless. The plan had been constructed carefully, reviewed annually, adjusted thoughtfully. It simply had not accounted for this, not because this was unforeseeable, but because there is a difference between naming a risk and genuinely building for it. The administrative moments are what she wasn't prepared for, not the grief. She had prepared for grief in the way people prepare for the deaths of those they love, even while hoping to be wrong. What she hadn't prepared for were the forms, the billing disputes with the care facility, the phone calls to Medicare about coverage categories. The afternoon she spent on hold for 40 minutes trying to understand why a particular therapy had been denied, a therapy that Paul's neurologist had described as important, while Paul sat in the other room not understanding why she was on the phone, or the morning she realized that the checking account they had maintained jointly for 31 years would need to be restructured because Paul could no longer sign documents. That was a Tuesday. She remembers it as a Tuesday, though she's not sure why the day of the week stayed with her. She sat at the kitchen table with a bank representative, a young man who was kind and efficient and who clearly dealt with this kind of thing regularly, and she signed her name where he indicated, and when it was over, she sat for a moment before getting up. The account still had both their names on it. She had not asked him to remove Paul's name. She just added her own as the sole authorized signer and let the rest stay the way it was. What no planning document captures, what no planning term captures, is the specific texture of the experience, the way the risk is not a single event, but a slow-motion reveal, the way the financial exposure accumulates quietly, month by month, while the primary experience is not financial at all, the way you can be simultaneously managing a healthcare crisis, a grief process, and a budget restructuring, and the budget restructuring keeps demanding attention at the worst possible moments because money does not observe any kind of emotional timetable. Her daughter calls every Sunday. Her daughter is careful, attentive, present in the ways that she can be from 800 miles away. One Sunday early on, her daughter asked, "Mom, are you going to be okay?" Financially, I mean. Linda said yes. She believed it at the time. She believes a version of it now. She will not be destitute. She will not lose the house. She has options she has not yet exercised. But the yes she would say today is a more qualified yes than the one she said then. The word has more weight in it now, more awareness of what it costs to say it with confidence. The thing Linda said to her daughter, the sentence that her daughter did not know how to answer, was not about money. We did everything right. We really did. She said it about 6 months after Paul's diagnosis on one of the Sunday calls. She was not looking for reassurance. She was not in crisis. She was making an observation that she needed someone to acknowledge in the same way that you sometimes need someone to simply confirm that what you are perceiving is real. They had done everything right. By every standard the retirement planning industry uses to evaluate preparation, they had prepared. Adequate savings, Social Security optimized within a reasonable range, housing secured, advisor relationship maintained, annual reviews completed. The observation was not a complaint. It was something closer to a structural finding, that doing everything right is not the same as being protected against everything that can happen, that the plan is always necessarily a plan for a probable future, and probable futures and actual futures are related but not identical. What Linda's situation exposes is something the retirement industry has been slow to confront, that the primary risks of retirement are not market risks. A portfolio can recover from a market decline. The account that loses 40% in year one can, with time and continued growth, return to and exceed its previous value. Markets have always recovered over sufficiently long periods, and there is genuine basis for the conviction that they will continue to. But a long-term care event does not recover. A widowhood tax spike does not recover. A healthcare cost that arrives before Medicare eligibility and drains the taxable account does not recover. These are not investment risks. They are life risks that have financial consequences. And life risks operate on a different logic than market risks. They are not distributed evenly across time. They often arrive in combinations, and they do not respond to the strategies that work for managing a portfolio. Linda's advisor was a good portfolio advisor. He managed the market risk well. The risks that landed were outside the portfolio, and therefore, in some essential way, outside the frame. The system is organized around the risks it can model and price, and life contains risks that resist modeling, not because they are rare, but because they are personal. Because they arrive inside a specific life, inside a specific marriage, at a specific moment. They arrive on a Tuesday.